All right, so we're going to talk about two lower limb and nerve related injuries. And this is basically what is known as the L5 radiculopathy and also the sciatic nerve injury. So we'll talk about them together. Okay, so first is the sciatic nerve, and you see the L5. Okay, this is the L5 radiculopathy. Okay, so I don't let me try to see if I'm able to see the size of this, you know. Okay, I'm just trying to see something. Okay, that's better. All right, so starting, we said that the L5 radiculopathy and sciatic nerve injuries, they are related. Do you understand? But they're actually different conditions in the lower limb. Okay, so starting with the L5 radiculopathy, which is this. What could be the L5 radiculopathy? So it's a compression or irritation of the L5 spinal nerve. Now the L5 spinal nerve is the nerve that is exiting, going out between L5 and the S1 vertebrae. So if the spinal cord was properly drawn, around this region you have the L5 and the S1 vertebrae. Do you understand? So if the nerve there is compressed, you have the L5 radiculopathy. Please listen so that you get the difference. Well, what are the causes? Lumbar disc herniation, spinal stenosis, spondylolisthesis. Those are the possible causes. I have a lot of pain radiating from the lower back into the lateral thigh, okay, the lateral calf, and also the dorsum of the foot. There's also weakness in the ankle dorsiflexion. There's toe extension and hip abduction. And there's also sensory loss. Do you understand? The person cannot be able to feel when you touch that particular place that is supplied by that nerve, simply because the nerve has an issue. Okay, then also there's the sensory loss is at the lateral side of the leg and also the dorsum of the foot. So clinical sign is the person is having difficulties on walking on the heels. If you ask them to tiptoe, do you understand? You ask the patient to tiptoe. That's the basis or the importance of neurological examinations for gait. You ask the patient to tiptoe and they are not able to tiptoe because of weakness. Okay. Now going to the sciatic nerve compression. Okay. Okay. So let's move. Sciatic nerve now is damage to the sciatic nerve, which comprises of what? L4, L5, S1, S2, S3. So L5 radiculopathy is L5 only. But if you are talking about the whole bundle of nerve there, they call it the sciatic nerve. So if the whole, see, all these nerves here, if you're talking about L5, you are talking about this one only. But if all these nerves are compressed, you call it the sciatica or you call it the sciatic nerve injury. Okay, so causes could be trauma, all those pelvic fractures, pelvic hip dislocation, iatrogenic, probably they did a surgery there, so it has some issues. Intramuscular injection, the buttocks is like this, okay, divided like this. And if you want to give an injection, you have to divide this one into four, okay, and give it, I think it's here, right? Yeah, outer quadrant. So if you give it anything here, you can actually injure those bundle of nerves that go out of this place. All right. So symptoms is what? Pain is radiating down the posterior thigh and the leg. There's weakness in the hamstrings. Okay, all muscles below the knee are affected. There's sensory loss over the posterior thigh and the leg and what most of the foot, because this region all is supplied by that nerve. Okay, so clinical sign is there's more issues because many nerves are affected. So we call it a global weakness. For L5 radiculopathy, you call it a focal weakness, just at a particular site. Then for the more ones affected, they call that a global weakness. The weakness is much now. All right. So that's how they also classify seizures, right? Our focal seizures, global seizures. Okay, so that's it, and I think basically that's what we got for the two. Okay, trying to know the subtle differences between the two injuries.